Eva, welcome to a regular press conference regarding the situation.
The COVID-19 crisis has illustrated that even the most sophisticated health systems have struggled to cope with the pandemic. WHO has grave concerns about the potential impact the virus could have as it starts to accelerate in countries with weaker health systems.
Dr. Tedros will now formalize this agreement by signing.
Of course, the pandemic remains a public health emergency of international concern.
Thank you very much, Mr. Hoyer, and hope this answers the question from Sarah Wheaton.
We will continue working with countries and partners to enable essential travel needed for pandemic response, humanitarian relief and cargo operations, and for countries to gradually resume normal passenger travel.
Now we will go to Uganda, to Pamela Mawan.
Also, malaria deaths have fallen by more than half since the year 2000. Progress has stalled in recent years and may even reverse if the COVID-19 pandemic disrupts malaria control programs.
Entre confinamiento y medidas de salud pública.
Countries need to consider in the process of opening up their societies and their economies which measures to change or relax first and how to measure the impact of those changes. And what we hope obviously to see is that the reproductive number or not of the epidemic in any individual country will not jump up because of easing of certain measures. So it's really important as countries ease those measures that they're constantly on the lookout for a jump in infections, and in particular are dealing with transmission in special settings. And we've seen this in many countries. In Europe and North America, we've seen the disease in long-term care facilities. In places like Singapore, the disease in dormitories for migrant workers. So what we need to be able to do is understand that even if the disease is under control in the general population, there may be vulnerable populations or contexts in which the disease can take off again, spread, cause death, and potentially transmit back into the general community. So what we are advising is that countries take this measured, stepwise approach to the process and be ready, if necessary, to put back in place some of those public health and social measures if needed.
22nd and January 23rd. And if you could make the decision again, would you make a different one?
Many countries right now are struggling to capture the deaths that are occurring from COVID-19. There's a very good example across Europe through the Euromomo project, which is capturing excess mortality in many countries across Europe. And excess mortality right now is very high. And so I think it will take some time for us to really understand which deaths are due to COVID-19 directly in terms of the infection causing that death, and which of the deaths are associated with COVID-19, either because someone has died because they didn't get care for some other reason.
We have listened again and again to numerous scientists who've looked at the sequences, looked at this virus, and we are assured that this virus is natural in origin, and what is important is that we establish what that natural host for this virus is.
We will try to go to Spain now. Cristina Masdiari.